there's been tremendous progress in treating HER2 positive breast cancer. It really used to be the most poor prognosis early stage breast cancer that we had because it was driving and we had no way to inhibit it basically. And so the initial approval in 2005 of adjuvant trastuzumab made a sea change in the outcome of these patients, but still with disease-free survival, about 25% of patients were having recurrent disease, about 16% having distant metastasis. So again, pertuzumab has made a definite difference in the invasive disease-free survival, no question about it. Standard of care now for node positive or T2 or greater breast cancers. The addition of the TDM1, another major improvement in outcome for these patients. Now getting those with residual disease, which are our highest risk patients after preoperative trastuzumab, pertuzumab, and chemotherapy, getting them up now into the high 80% chance of remaining disease-free, but still we have recurrences. We still have recurrences in ER-positive disease. They can be late recurrences. We still have brain metastasis, which is an increasing problem for patients with any kind of disease burden at presentation. They have likely seeded the brain. ER negative more than ER positive, but there's a spectrum of ER positive biology. Some of it's very close to ER negative disease. So these are our remaining concerns. The neratinib data, I believe, based on the Extenet trial and the non-cross resistance that we see in the metastatic setting of neratinib, will further reduce that risk. Based on trials such as the Nefertiti, which was metastatic disease, it reduced the risk of progression in the brain with the neratinib. It's likely that we will see a reduction in brain metastasis with the utilization of neratinib. And neratinib in combination with TDM1 in the metastatic setting is a safe and effective combination. So an obvious question is to utilize neratinib in the adjuvant setting in patients who still have residual disease who are getting TDM1 to add the neratinib there to try to decrease brain metastasis. Another agent coming along, very similar thinking, is the tucatinib, awaiting FDA approval in the metastatic setting for tucatinib, clearly effective in the metastatic setting at preventing progression of brain metastasis, even untreated brain metastasis. Very exciting agent for the brain, being combined now in the metastatic setting with TDM1, also entering the adjuvant setting in combination, TDM1 plus minus neratinib. Again, very, very exciting new avenue. We also have newer antibody drug conjugates, trastuzumab deruxtecan, recently approved by the FDA for the metastatic setting, going head-to-head in the metastatic setting against TDM1. If it is more effective than TDM1, it too will go into an adjuvant setting in a Catherine-like model. So lots of agents. Progress is not over yet for HER2-positive breast cancer. We're really getting there, but until the job is not quite done yet.